Hello, my name is Michael Ekago, and this is my EBP project proposal. The topic is smoking and substance use among minority older adults. Significance of the problem. Smoking and substance use represent a significant public health among minority older adults in the United States. According to SAMHSA, over 1 million age 65 and older have substance use disorder. Notably, according to CDC, 8.3% of adults aged 65 years and older smoke cigarettes. Minority older adults are disproportionately impacted by smoking and substance use. According to SAMHSA, among adults aged 50 years and older, is about 5.2% of biracial, 4.6% of African Americans, and 4.2% of Alaska Native have substance use disorder. Notably, SAMHSA estimated that 2% of African Americans, 0.8% of American Indians, 0.7% of Hispanic, and 0.3% of Asian Americans use illicit drugs. SAMHSA also found that ethnic minority older adults have a higher incidence of alcohol use disorder. For instance, the survey found that incidence of past year alcohol use disorder for adults aged 50 years and older is higher among individuals reporting 2 or more race. That's about 3.9% compared to other races. Significance of the problem continued. Smoking and substance use has been linked to adverse health and economic burden for minority and older adults. Smoking has been linked to an incident risk of developing diabetes, cardiovascular conditions, COPD, certain types of cancer, osteoporosis, and eye diseases among older adults. Notably, substance use has been linked to increased fall risk, higher cardiovascular risk, cognitive decline, sleep disorder, and reduced quality of life. Hence, there is a need to implement evidence-based interventions to address smoking and substance use among minority older adults. The EBP project question. This EBP project question was gathered by following a pickup question in minority older adults aged 65 years and above, which present the P, and does the implementation of peer recovery coaching, which represent the I, and compared to the usual care, which is the C, result in higher rates of smoking cessation and reduced substance use, and that represent the O, within 3 months, which is the T. Review of literature. To obtain evidence-based literature search was conducted in 2 databases, including PubMed and Sina. To retrieve narrow results, keywords were used. Some of the keywords used in the literature search includes smoking, substance use, smoking cessation, peer recovery coaching, peer support programs, and ethnic minority older adults. Boolean operators were also applied to retrieve more focused results. This includes peer recovery coaching and substance use, peer recovery coaching and smoking, peer recovery coaching and ethnic minority older adults, peer recovery coaching and substance use or smoking. Summary of evidence. There are 2 articles used in this program, the climber and after. Design use and evaluation research design was used, in which the researchers compared data on outcome measures in the pre-intervention, and post-intervention after a month. And after, mixed method experimental research design was used that involved experimental research and qualitative research design. And the sample is about 39 homeless and low-income individuals with substance use disorder. The mean age of the sample in this study was 58 years, while in after there were 389 participants who were smokers. The sample in this study comprised about 55.5% African Americans and 9.5% whites and 35.0% in other races. The participants in this study had a mean age of 47 years. Intervention, peer recovery coaches, the PCR model was used in Climber, and after peer-led group counseling and nicotine replacement therapy were used, and the dependent variables, the DVS, linkages and retention in substance use treatment, while in Aperture, smoking status retention cessation program was used, and measurement of variables, analyzing and comparing data on outcome measures in the pre-intervention and post-intervention. And after, they used multivariate logistic research to assess the changes in the smoking status of and retention. Summary of evidence continues. The findings, the PRC model linked about 64.1% of the participants and had a follow-up rate of 59.0. The intervention resulted in 52% retention in substance use treatment. Compared to the other article from after, peer recovery coaching resulted in 21% improvement in smoking cessation rates. The intervention resulted in 51.9% retention in treatment program. The intervention has high acceptability among low-income ethnic minority. Recommendations: peer recovery coaching programs should be implemented in community settings to improve linkage and retention in substance use program among low-income ethnic minorities. Peer recovery coaching program should be tailored based on individual goal and changes in readiness for the program. Compared to the other article, peer-led counseling an effective approach that should be used to improve smoking cessation rates and improve acceptability in ethnic minority populations. Recommended best practice. The recommended best practice identified in the literature was the implementation of peer recovery coaching. Peer recovery coaching has been found to be effective in improving smoking cessation rates and reducing substance use in ethnic minority populations. The study by Apter reported that community-based peer recovery programs resulted in a 21% smoking quit rate. Furthermore, peer recovery coaching has been found to be effective in improving linkages and retention in substance treatment. The finding of Calimer revealed that peer recovery coaching was effective in improving linkages and retention in substance use treatment among low ethnic minorities. Calimer also indicated that peer recovery coaches linked about 64% of the participants to treatment programs. Kaliman also revealed that the peer coaches model resulted in 52% retention in substance treatment. Similarly, Apter found that that peer-led recovery smoking cessation program resulted in 51.9% retention in treatment programs. Notably, Apter also found that peer coaching intervention have higher usability and acceptability among ethnic minority. Hence, based on the literature, peer recovery coaching is effective intervention that can be implemented to improve smoking cessation and also reduce substance use and increase treatment retention. Policy and protocol for practice change. The proposed policy is integrating peer recovery coaches in smoking cessation and substance use treatment programs for minority older adults. The main element of this policy will be including training requirements of peer recovery coaches, the role and limitations of peer recovery coaches, the structured intake process of eligible participants, and the process of organizing coaching and support sessions. The protocols for practice change will include seeking and gaining approval from the organization's leadership, recruiting peer recovery coaches who have not smoked or used substance for at least 1 year, providing comprehensive training to peer recovery coaches, and also familiarizing peer recovery coaches with the organization's regulations and ethical standards, and also matching peer recovery coaches to interested older adults. Implementation plan. This practice change will involve integrating peer recovery coaches in smoking cessation and substance use treatment program for older adults. This intervention will involve nurses. Other healthcare professionals will also be involved in the treatment of substance use, and peer recovery coaches and older adults with smoking problems or substance use disorders. The program will also include trained peer recovery coaches with facilitated group and individual counseling, and the counseling session will focus on establishing achievable recovery goals, addressing barriers, and relapse prevention. Furthermore, peer recovery coaches will conduct regular follow-ups and with the participants to assess their progress. The intervention will be conducted over a period of 3 months. Also, the estimated cost of the implementing this program of change is about $100,000. Evaluation plan. The main outcomes that will indicate the practice change has been successful includes a reduction in substance use, increased rates of smoking cessation, increased retention in smoking and substance treatment. Also, staff and patient perception of the intervention. The following strategies will be used to evaluate the practice of the change proposal program, and that will be the alcohol, smoking, and substance involvement screening test. This will be accomplished by giving a questionnaire to the participants and It will be used to assess their smoking and substance use status in the pre and post intervention. Qualitative analysis will be conducted to analyze the changes in these outcomes. The retention rate will be measured by monitoring participants' perception in the program using the attendance registry. Surveys and interviews will be used to assess staff and patient perception of the intervention. Also, nurses and trained peer recovery coaches will be responsible for collecting data. The staff will receive feedback using surveys, interviews, and focus groups. In conclusion, smoking and substance use has been linked to adverse health and economic outcomes among minority older adults. Despite sufficient evidence supporting this efficacy of smoking cessation and substance use treatment, minority older adults continue to experience worse treatment outcomes. This EBP project recommends integrating peer recovery coaches in smoking cessation and substance use treatment programs to improve successful smoking and cessations and treatment outcomes for minority older adults. Thanks for listening, and these are my references.